So, hello everyone. Uh, Today we'll have the final quiz on ortho. So today we'll be having a quiz on lower limb, metabolism, bone disease, joint, and other miscellaneous topics given below.
Hello
So the
everyone,
quiz will
kindly join.
start at yeah.
Yeah, proceed.
The quiz will start at 10:10, exactly at 10:10. So those who will join, please scan the QR code or the link provided in the Telegram group or in the YouTube comment section.
Kindly join the quiz quickly. We are going to start in some time. Today's quiz is on orthopedics, part 3 topic. Link for the quiz is shown on the YouTube screen, as well as it is given in the YouTube live chat section. Okay, YouTube live chat section. You can find the link of the quiz. So whoever has not joined, kindly join first because we are going to start at 10:10 p.m. With today's
And
quiz,
today will be our yeah,
finishing
yes, sir.
we'll be finishing orthopedics, and from tomorrow onwards, we'll be going to OPG. Hello everyone, we'll be going to start in next 3 minutes. So please join the quiz. So we already have around 30 players who are ready. So whoever has not joined, kindly join quickly. We are going to start soon. The one who is named Dr. RMD, so that's not me for disclaimer.
Sir, they have tried all of our name actually. In one of the quiz, there was my name also.
We see Dr. Thor. So hi Soumya, Sriraj, Hemant. So these are regular Shanmuga Priya and Vishnu Priya. So these are regular players. I can see some new names also. Why is Rakesh so sad?
Sir, have you observed that we get more of crying emoji than any other emoji there?
Yeah. Right, crying emoji has so much. Maybe they are like scared or they are just not sure about their
Uh-huh.
preparation.
Maybe, sir. I think that is the reason.
Rakesh is happy now. Rakesh is the only one with who is who is flashing multiple emojis. So we'll be starting in next 2 minutes. Yes, I think we are good enough to start, Manoj.
Yes, sir. We'll start.
Okay, we'll start. So, welcome to another exciting episode of JuxtaMed Quiz. Today, we are diving into orthopedics with some tricky clinical cases. I'm Dr. RMT, and joining me is Dr. Manoj. So, here is your first question on clinical case. A 65-year-old woman presents with chronic knee pain that worsens with activity, very important history, and improves with rest. On examination, there is bony enlargement of the distal interphalangeal joints, very important thing, and crepitus in knee joints. So, what is your diagnosis? Your time starts now.
To give a clue, think of a condition that commonly affects the older population, often with wear and tear of joints. You might also spot some bony bumps in the finger. By seeing X-ray, I think you'll get a idea.
Yeah, age along with the joint pain which worsens with activity, along with involvement of interphalangeal joints. So that should point towards diagnosis. Yes, almost everyone has answered it right. So now it's the fastest fingers. Hemant is leading, followed by Soumyashri, Tanya, Shamili, and Mayra. Moving on to the next question.
A 72-year-old man presents with acute pain and swelling in his right knee. There is no history of trauma. Joint aspiration reveals rhomboid shape, positively birefringent crystals under polarized light microscopy. So, what will be your diagnosis?
So very important, like in comparison to the previous question, here also there is an elderly person, but there is pain in the right knee. Last also there was pain in the right knee. Okay, so there is no issue of trauma, and joint aspiration reveals crystals. So there are two differential diagnoses for this, and you'll have to differentiate between gout and pseudo gout. Okay, so this is not gout because you're getting rhomboid shape positively birefringent crystals. Okay, so the answer is calcium pyrophosphate deposition. That is pseudo gout.
Hmm. In gout, you can get a needle-shaped crystal with negatively birefringent crystals.
Yes, correct. So this is positively birefringent crystals. So Hemant made this mistake, that's why he's sad. And now Kamesh is leading, followed by Tanya, Myra, Sika, and Rakshaya.
Okay, guys, moving on to third one. A 13-year-old obese boy presents with a limping gait and dull pain in the left hip and knee for 3 weeks. On examination, there is restricted internal rotation and abduction of the hip. So, what is the diagnosis?
So this same question is actually a neat super specialty question also in pediatrics. I was just going through neat SS questions because I was preparing for a pediatric rheumatology quiz, and I came across same type of question. So this is very important. So you need to differentiate between SCFE, okay, and purchase disease. These two are very important differentials in 13-year-old male. So I think the age is the clue, right, Manoj?
Yes, sir. Age will be a clue, and X-ray can also help us in the answer, sir, actually.
Yeah. So purchase, I think, is common maybe from 5 to 9 years, something like that, in younger
Yes,
age.
sir. Yes, sir. Yes, sir.
And in
And
transient
in
sinusitis,
Perthes, I
like
think
uh,
the head of femur will be somewhat necrosed or
correct, yeah,
pathology will
yeah,
be seen, whereas
yeah, right.
here, yes.
So transient sinusitis will have some history, and DDH will present in a much younger children.
Hmm.
So right now leading is Tanya, followed by Mayra, Kalaivanan, Krishna, and Ram. So these cases are like very much the same type of cases which we expect in exams, where students get confused. So next question.
You can take this.
Okay, a 6-year-old child falls while playing and lands on outstretched hand. Very important. He complains of pain and swelling over forearm. X-ray reveals fracture where the cortex is disrupted to but on one side but intact on the other. So what is the most likely type of fracture? Good question.
So here one clue is the fracture is seen in a child, and as you know, the children will have a soft bone because it's incomplete, but due to an angulation in the limb. Yeah,
So
it's
the
right.
answer
Green
is
stick fracture.
brain stick fracture. Yeah. So Myra and Tanya both are leading, followed by Kalaivanan, Krishna, and Sundar. Okay. So moving on to the next question, Dr. Manoj.
A
25-year-old
25-year-old football. Yeah, you can do it. You can take.
25-year-old football player presents with acute pain and swelling in the right knee. Very important. Acute football player with acute pain with sudden twisting injury while changing direction. He was unable to continue playing and felt a pop at the time of the injury. So, which test is appropriate? So, first you have to diagnose the condition. Second is what are the menus that you use?
Yeah, think about a test that helps diagnose the ligament injuries of the knee, especially when twisting motions lead to instability.
Yes, it is anterior drawer test. I think it is regarding PCL ligament, right?
Yes, sir. ACL ligament,
ACL. Okay. Okay.
because ACL will be more
Okay.
commonly injured.
Okay. So yeah, this one is one more very important question that is repeatedly being asked in entrance exams, where you are likely to get confused. So I think there is a pearl on this, which you should actually learn and bookmark. So tables have
Mm.
toppled like anything. Now Myra is leading for the first time, followed by Krishna, Kalevanan, neurosurgeon. I don't know if it was ortho surgeon something. The orthopedist would have been more helpful. Followed by Talia. Let's see what others are doing. Sixth position is X is at sixth position, followed by Sneha, Sundar, Sriraj, and Soumya.
Okay, guys, here's your sixth one. A 70-year-old man presents with hip pain and inability to walk after a minor fall at home. Examination reveals shortening and external rotation of the right lower limb. Which of the following is the most appropriate treatment here?
Yeah, so think about this condition where femoral head is displaced. As you can see in the X-ray, femoral head is displaced, and treatment will involve surgical intervention if it is a older adult. So mainly the answer should be a surgical intervention. So I guess it is hemiarthroplasty.
Yes, sir.
So
Age is
it
a
is,
very important factor.
yeah, correct. Ages. And why are we getting only one person was able to answer this?
I
Was there
think,
any? I think this is a glitch, maybe.
yes, sir. I think they did not get the question, I guess. The timer was
Okay, let's see scoreboard. There was some glitch in this question.
not matching.
That's why many
Yes,
of
sir.
them were not able to answer. Okay, here's your seventh question. A 4-year-old child from low income background presents with irritability, swollen gums, very important to multiple bruises on legs. X-ray of lower limb shows ground glass appearance of bones, a white line at the metaphysis. I think you shouldn't have named it Frankel line. So now it's the diagnosis is very much clear, along with periosteal elevation. So what is the most likely diagnosis? A few points I need to add on. This type of X-ray nowadays you won't see at all. Okay, I haven't seen any. Even my consultant, my faculty haven't seen any cases of scurvy. Secondly, this white line of Frankel and all this Wimberger sign, right? Okay, all these are very rare nowadays, and scurvy was once upon a time a common disease, but right now scurvy is not at all same. I remember, like in my senior's exam, one of the consultants had kept this X-ray, and none of them could diagnose it because no one thought that it could be scurvy. Just based on X-ray, you can't diagnose. Third is one more condition where you get like swollen gums, you have multiple bruising, and then you get this X-ray. Like if the clinical picture is this and you are not given X-ray, then one more differential diagnosis can be hemarthrosis. Okay, where there could be
Mm-hmm.
bleeding into the joint. That also causes there could be like joint swelling. There can be bruising from the lips or from the gums. Okay, so those things can happen in arthrosis, especially in hemophilia. That is one more diagnosis. But when X-ray is given, the diagnosis is pretty much clear. Also, because of this bleeding into the joint, it can cause pseudo paralysis also. That is also one more point in favor of scurvy. Myra is leading, followed by Krishna, Kalaivanan, Neurosurgeon, and Tanya. So leaderboard is pretty much the same. Yes, another very common pediatric question. So 2-year-old child with nutritional rickets presents with both legs, widening and frontal bossing. So which of the following is used? Very important question, and like you can't afford to miss this question.
Yeah, can you guys also tell what are the other protocols given there for which condition they are used?
Is those who are watching this YouTube live, kindly comment in the live chat comment section, like which protocols are rest of the uh, options for. So yeah, it is toss regimen. Even the toss regimen is like older regimen, okay, but still nowadays we use toss regimen only because it is very effective. So Myra is leading, followed by Kalayanan, Krishna, Tanya, and neurosurgeon.
Okay, last second question. A 30-year-old male falls on an outstretched hand and sustains a mid-shaft humerus fracture. On examination, he has weakness in wrist extension, finger extension, and thumb extension. He also reports numbness over the dorsum of hand. Which of the following is the most likely diagnosis? Which nerve is involved here?
So a question which combines anatomy plus your ortho knowledge, but I think anatomy is enough. The muscles which control wrist
Hmm.
extension, finger extension, thumb extension. So extension is mainly by the radial nerve. So mid shaft humerus fracture. So in the radial groove there could be injury. So the answer should be radial nerve injury. There is no doubt in this. Posterior interosseous nerve injury will happen when there is injury to the forearm, where the origin
Yes,
of
sir.
posterior interosseous nerve occurs.
Hmm. In
So the
Monteggia
humerus,
fracture.
yeah, in Montage effect, correct. One more question they can ask is axillary artery injury also, where pulse is not felt. What is the next step of management? That is also very important question in
Hmm.
humerus fracture. Myra is leading. Myra is determined to win today's quiz, followed by Kalaivanan, Tanya, Krishna, and neurosurgeon. 25-year-old male sustains a deep cut over middle side of the wrist after falling on glass. On examination, he has weakness in finger and abduction and adduction, wasting of hypothenar muscles on and claw hand deformity. So, which nerve is responsible? Again, a very classic question.
Yeah, if you know the anatomy better, then you'll easily get the answer.
Yeah. Hypothenar muscle supply, if you know, I think you can answer. Claw hand also, if you know. Uh,
Hmm.
but when I say this question, when I was doing my casualty duty during internship, I came across a similar case of a person. But there was a deep
Oh.
cut. It was on the wrist. And the patient said it was because of glass falling on him. He fell on the glass something. But then we
Mhm.
realized that it was suicide actually. And
Whoa.
so like you get it, no? Like middle side of the wrist. Then they said it is a glass injury, but
Yes,
there is a
yes,
clean
sir.
cut. So when I say this
Hmm.
question, I just remembered of that case.
And they specifically choose breast area, sir. Maybe.
Yeah, yeah, right. So the answer is Alnanar. Okay, I don't know why Myra committed mistake in this. So leading the way to Kalaivanan at last moment. I think Myra answered radial nerve. Sorry, median nerve.
Yeah. Yes, sir. Maybe.
So Kalaivanan is the winner. So congrats, Kalaivanan.
Congrats, Kalebanan.
Followed by
And
Myra and Krishna. So congrats, Myra and Krishna. Followed by
congrats,
Tanya,
guys.
Sneha, Soumya, Sundar, Ram, CK, and Raksha. So congratulations, everyone. So come back to YouTube Live. So let us know in the YouTube live comment section about today's quiz. I think there was one glitch which we agree. I think that was for seventh question probably. But
Yes,
that
sir.
glitch wouldn't have affected your results much because no one got it correct, I think.
Only,
It was common for
yeah.
everyone. So I guess that was a glitch in the platform that we used. Okay. So other than that, I think today's questions were really great, Manoj. You have done an excellent job creating very good questions. Questions were very clinical,
Thank you, sir.
especially they were comparison type of questions and similar type of questions where students will commit mistakes always in exams. So
Thank
if
you, sir. Thank
anyone
you.
who has attended this quiz and they would have gone through question, they would have realized where they exactly go wrong. So with this, we conclude orthopedics. So we have finished orthopedics in 3 days. Do comment in the comment section if you also have finished orthopedics in last 3 days. Because if you start without any without any plan and you think of finishing, you wouldn't be able to finish in 3 days. But when you have a quiz daily, then you're bound to complete those topics in the given time. So
Yes, guys, please comment. It will be motivating to others also to finish something. They'll see many of them have finished and they'll feel FOMO outside.
yeah. So how many of those who ever have finished orthopedics in these 3 days, please comment in the comment section. Yes, Exporting has commented that he has finished orthopedics in these 3 days. So great job, Exporting. We don't know your real name. Anyone else who has finished orthopedics in these 3 days? Okay, Rajan Srivastav has commented that he has also finished orthopedics in the last 3 days. So that is good actually. Or else you'll be dedicating 1 week or 10 days for just one subject, which is not of much importance. There are only a few important questions. But when it comes to like topics like orthopedics where you want only important things and not to miss any important things, then less time is enough. Okay, 3 days are more than enough to finish such a major subject. Again, you will be revising this in GT and all. Okay. Yes, so Vishnupriya, Nirmal, Javed, Ashish, Melisha, Hima, Sai Krishna has completed almost 80 to 85. Kalai has completed. Kalaivan, yes, we understood. When you won the quiz, means you have completed ortho. So, yes. So, all this have told that they have finished orthopedics. So, that is a great thing. So also do inform your friends, also do inform anyone who are struggling with the completing syllabus. So they can also join the quiz. It is not about winning, okay? It is about completing things and revising things, okay? So डॉक्टर निर्मल दास सर कब सभी सब्जेक्ट के बाद फिर से स्टार्ट होगा सर यस क्विज विल कंटिन्यू ओके so once are done with the preparation phase that will end by April 15th, then during revision phase also we'll be having these quizzes, okay? Maybe the frequency will decrease, maybe once in 2 or 3 days we'll be having, but we'll be having the quizzes, okay? We'll continue till NEET PG is done, okay? So for other subjects, Hima, we have done the quiz. Okay, from tomorrow we'll have OBG. OBG schedule will be released in Telegram group in some time. So once that is released, one more important thing is OBG finals. We are planning to do it as a cash prize based event. Okay. So I guess everyone who are there already would like to have a cash prize based event also. So we are planning for that, and we'll be giving you the instructions regarding the same in the upcoming sessions. Okay. So from tomorrow we'll be having OBG. That is tomorrow 30th. For 6 days we'll be having OBG, and on seventh day, I guess on fifth of February
Yes,
we'll
sir.
be
Fifth.
having OBG
Hmm.
grand finale, and that will be a cash prize based event. So Nirmal sir, कब तक syllabus खत्म होगा? According to this, the top 10 subjects will finish on February 28, and rest 9 subjects will be finishing by April 15th. So before April 15th, we'll be covering total syllabus. From April 15th till May 18th, we'll be giving first revision, mainly INICET oriented. And at that time, during that INICET revision phase, we'll be focusing our quiz mainly on INICET important topics only. We'll slightly try to change the pattern of the quiz. Okay, we are planning to do that. We'll be keeping it more of INICET based. And after that 1 month, from May 18 to June 15, will be our second phase of quizzing. Okay, that is mainly NEET PG oriented. Okay, so tomorrow onwards we'll be having OBG. So prepare OBG very well because grand finale of OBG will be cash prize based. We are planning to give first, second, and third prizes also. Okay. So see you guys then. The this one, the schedule of the quiz, that is for OBG timetable. We'll be releasing it in YouTube post, or we'll be releasing on Telegram. We'll be releasing on Dr. RMD WhatsApp channel. We'll also be releasing on Twitter and Instagram also. Okay. So yeah, Vishnu Priya, thank you for the feedback. We are actually happy to see that you guys are like coping up with the schedule. You guys are doing great. Okay. So the final output is you guys completing syllabus. That is most important rather than anything else. Okay, winning is not important. Important is you guys finishing the syllabus, because once you finish syllabus, only then you will be able to revise. So the main point of JuxtaMed quiz was to uh, make you accountable, like you make you achieve your targets. That was the main aim behind this. Okay. So we'll be coming live again tomorrow at 10 p.m. with OBG topics. So till then, good night.